Okay, good morning and welcome from the Greater Bristol County Attleboro Taunton Coalition and Homelessness, GB Catch, the Homeless Service Providers Coalition in Fall River, the HSPC, and the Homeless Service Provider Network in New Bedford, the HSPN. Our three continuums have gotten together and are hosting this Medicare presentation. We're lucky to have Matt Dansereau presenting for us this morning. Matt is the engagement coordinator with the Dartmouth Council on Aging, and he is a Shine counselor, and we look forward to his presentation. As I mentioned earlier, this session is being recorded. We will be posting a copy of this on our YouTube channel, which will be accessed. You can get that through the HSPN website. I will put that address up in the chat box, but it is nbhspn.com. And if my technology holds out, I will be posting that by the end of this week. So stay tuned for that. And without further ado, Matt, if you are ready to begin, you should have access to sharing the screen. You can let me know if you do not, but the floor is yours. Great.
Okay.
We can see everything. You're good to go.
Okay. So again, my name is Matthew Dansereau. I actually know a lot of you already because I have a history of working in New Bedford nonprofits and low-income, homeless, disability, that type of thing. I've been working for the town of Dartmouth for about a year with the Council on Aging. I'm, again, a Shine counselor. I'm a Mass Health CAC. I'm also SNAP certified. I'm Social Security certified, and my services are open to anyone in town. We've been working a lot with the homeless in town, and a lot of you know there's probably a decent, good-sized homeless population in Dartmouth. And one of the things that I'm sure a lot of you are seeing are people turning 65 and, you know, the world coming to an end because they're going on Medicare and they can't qualify sometimes for the stuff they used to qualify for. And so we're going to talk a little bit about that. Medicare is very complicated. There might be a lot of questions. Best thing to do with questions, chat or raise your hand. I'll try to answer as we go along. Medicare is also not one size fits all, so there might be a lot of very specific questions, and it might be better to contact me individually for those. So we'll kind of deal with that as we go along. So again, health insurance at age 65 is very complicated. Not a one-size-fits-all approach with either Medicare or Mass Health.
Matt, I just want to interrupt for 1 second. We are getting feedback on your line. I'm not sure if that's something on your side or what's happening, but you want to just be aware of that?
I think it's because everyone else needs to make sure
there might be somebody else here on.
Yeah, audio working?
Or maybe everyone needs to be on mute.
Yeah.
If everyone can be on mute, that might help.
Okay.
Right here.
Thank you.
Better?
And then go to audio.
No, it's still a little echo.
And hello?
There are still people who are not muted.
Oh.
Oh, sorry.
Better?
Yes.
Better. Okay, there we go. All right, so as I was saying, health insurance is very complicated once you hit 65. Still a little feedback, I can hear it, but there's not a one-size-fits-all approach with either Medicare or Mass Health. And even clients with similar incomes and demographics might end up in different complete plans. Also qualifying for public benefits, Mass Health, and the different types of Mass Health is a lot more difficult. There are lots of different public benefits. There's just not Mass Health Standard and the children's and that. There's a lot of different types of plans, and they all have income, assets, diagnosis, and different waivers. Some of them have all, some of them have some. And whether or not you're still working is usually a part of an assessment for public benefits. Medicare with the Mass Health Senior Buy-in, which I'll talk about a little bit later, is probably the most common setup for those who are lower income. One thing to remember too, if you have clients who are on SSDI or survivors benefits, that converts to retirement income when they hit SSI, when they hit 65. So that's a little bit of distinction. Social Security will actually change it to retire income instead of disability or instead of survivors benefits. So Medicare has some health insurance terms that you may be familiar with from your own insurance plans. I'm going to try to go over quickly so somebody has kind of an understanding of what they are. The first is a deductible. The deductible is a dollar amount a client has to spend before health insurance pays. Example, I have a $4,000 deductible on my insurance. I would have to pay $4,000 out of pocket before my insurance would kick into pay. Medicare also has premiums, which is a monthly payment, or sometimes it's quarterly payment that someone has to pay to retain health insurance. The premium you pay is usually paid a month in advance. So if you paid your premium in August, it would cover September. Medicare also has co-payments, co-insurance. People know that as co-pays. This is the amount someone pays when services are accessed or medication is purchased. And then a big term you hear a lot in, especially Medicare, is out-of-pocket medical expenses. This is the total amount for a given period that a client would pay out of pocket, includes co-payments, premiums, and deductibles. And this amount can be very important for qualifying for certain benefits like SNAP and subsidized housing. So what happens when you turn 65? You figure you're going into your golden years, and then you get the world's most complicated insurance. If you are on Social Security benefits, not including SSI, you will automatically receive a Medicare card for Part A and B around your 65th birthday, usually 3 months before it. In addition, as of right now, $164.90 for your Medicare B premium will be deducted from your Social Security payment going forward. That is going to change in October. It's probably going to get higher, but currently it's $164.90. If you are on SSI, you will probably most likely not qualify for Medicare because Medicare is based on quarters worked. And if most people who are on SSI either have never worked or don't have quarters worked, in that case, most people on SSI probably still qualify for Mass Health, but it's kind of a case-on-case basis. The exception to that, if you're on SSI and you're married and your spouse retires, you will qualify for Medicare based on your spouse qualifying for Medicare. So that's something to keep in mind. If you are turning 65 and not receiving any benefits from Social Security, you will not automatically be enrolled in Medicare. It is the recipient's responsibility to contact Social Security to enroll in Medicare when you turn 65. They will not send you any reminders or notifications. Neither Social Security or Medicare will do this. If you are on Mass Health, several months before your 65th birthday, it's averaging around 6 months, you will receive what's called the SACA application for Mass Health. That's the 65 and older application for Mass Health. You'll receive it in the mail, and you will need to reapply for Mass Health under the 65 and older rules. If you are on Common Health, again, several months before your 65th birthday, you will also receive a SACA application for Mass Health. And you will also need to reapply for Common Health under the 65 and older rules. If you have a Health Connector plan and you have 40 or more work credits and do not apply for Medicare, you will lose any tax credit savings you have for that Health Connector plan. Once you sign up for Medicare, you are no longer allowed to have a Health Connector plan. If you're on a Health Connector plan and have less than 40 hours of work credits, you might stay on your Health Connector plan because there's actually a premium for Medicare A if you don't have enough work history, which we'll get into in a minute. That's kind of on a case-by-case basis also. So depending on your situation, you also may be able to delay your Medicare enrollment. For example, you have creditable insurance coverage through work and you're not retired yet. But there are lifetime enrollment penalties if you miss your initial enrollment and don't have an exemption, for example, through work income, work insurance. And usually when I meet somebody, if they hit 65, I always encourage them to apply for Part A, because generally Part A is free for people at 65. And then if they have a way to waive the Part B, because they have work insurance, to waive the Part B until they retire. So what is Medicare? Medicare is a federal health insurance program created in 1965 for people 65 and older, and some people under 65 with disabilities. Probably should have mentioned earlier, if you're on SSDI, you will get Medicare after 24 months of being on SSDI. It is designed to help with their hospital and medical coverage. While Medicare helps with the cost of health care, it is not comprehensive. It does not cover all your expenses, and it especially does not cover long-term care. Medicare is not intended to be your only insurance. Of course, the world doesn't work that way. There are three different parts of official Medicare. There's Part A, which is hospital insurance, Part B, which is medical insurance, and Part D, which is prescription drug coverage. Beyond those, there is what's called supplement plans that kind of help cover the costs associated with A and B. There's Medicare Advantage, which you probably see tons of commercials about, Part C plans, and there's Medigap, which is a supplemental plan, and both are designed to help cover costs. And I'll get a little bit more into those as we go along a little further. So Medicare Advantage, also known as Medicare C, again, you will see commercials for this on TV. You will get seniors who will get mail for this constantly. It is basically an all-in-one alternative to original Medicare. If you're used to the Mass Health ACOs, it kind of operates like that. It basically takes your Part A and B and usually your Part D. And it's a bundled plan, and they're offered by private insurance companies under the rules and guidance of Medicare. Again, the plans usually include your Part A, Part B, and Part D. C plans can have much lower out-of-pocket costs than original Medicare. But the big issue with Medicare Advantage plans is they are usually HMOs or PPOs. So they're managed care, their regional care, their network care. And if you leave your network, your out-of-pocket expenses will be much higher, or there might be no coverage. Medicare Advantage plans will always cover emergencies out of network, because A and B will cover emergencies out of network. One of the biggest parts of a Shine counselor's job is going through Medicare C plans to figure out what's most cost-effective for a client. Medicare supplemental insurance, or Medigap. Medicare supplemental insurance is extra insurance you can buy from a private health company to help pay your out-of-pocket costs. They're per state. Each state has their own version of Medigap. You must have original Medicare A and B to buy a Medigap policy. You can't be on a C plan. And if you have Medigap, you will need a separate D plan to cover your medications, which you might also have to pay for. Medigap's advantage is there's no health networks. You can see anyone you want as long as they take Medicare. And there are 3 different supplements in Medigap. One is no longer available to those who are eligible for Medicare after 2020, which was the best supplemental coverage. So costs for Medicare A, B, premiums, deductibles, and penalties. This is the one that kind of throws everybody. Again, Medicare premiums adjust every October. They're based on the federal cost of living. Part A, as long as you have those 40 work credits, is going to be free. If you do not have 40 work credits, you can see how it kind of goes up per month to $278 to $506. Someone who is on Social Security might not have enough work history, and then they're getting stuck with this 278 or this 506 to have Medicare. Again, this is just vanilla Medicare. The standard premium right now for B is $164.90. That will come right off of the top of somebody's Social Security, as will the Part A will come right off the top of somebody's Social Security. The Part B premium can be higher, and it's based on your previous year's modified adjusted gross income. In addition, if you're higher on the $164.90, you will have an additional cost for Medicare D. So there are late enrollment penalties if you don't have an exemption and you do not enroll in Medicare at 65. For A, if you don't sign up by age 65, you will pay 10% of the premium if you have to pay for A. If your A is free, you don't. For B, you will pay 10% of the premium for every 12 months you did not sign up. So again, if somebody waited 24 months to sign up for B and doesn't have an exemption, they will get an extra $32 or so added to their $164.90. And it's a lifetime penalty. So you will retain that for the rest of your existence. For D, if you don't sign up for D or have drug coverage, it's 1% for every month you missed. And that's also a lifetime penalty. So you can see if you miss your Medicare signups and you don't have a good reason for missing them, you can literally get really expensive insurance that doesn't cover everything. This is a little chart that shows what the cost of your benefit is going to be for Part B. A married couple making less than 195,000 will be at that 164.90, and there won't be an adjustment. But as you see, as your income goes up, again, based on your previous year, the premiums go up on Medicare, or the adjustments to Part D go up on Medicare. Again, I'm not dealing with a lot of clients in these income levels. You're probably not dealing with a lot of clients in these income levels, but this might be good for information for anybody who's in here who might be dealing with these income levels. So Medicare A and B, again, are not comprehensive insurance. There are gaps in coverage. There are out-of-pocket expenses for both plans. A and B also have deductibles you need to meet before Medicare starts to pay. A and B are also time limited. The longer you spend in a hospital or a nursing home or rehabilitation, the more out of pocket it's going to cost you, till eventually it's just going to cost you complete out of pocket. Home care services are generally limited to 30 days. So if you need a visiting nurse, Medicare will generally pay for 30 days. So this is the scary part of Medicare. So Medicare A, if you go into the hospital for Medicare A, you have a $1,600 deductible to meet before Medicare will pay. This $1,600 deductible is not a yearly deductible. If you go into the hospital and you're there for 10 or 15 days, and then you go another 90 days without being in the hospital, and you go in again, that deductible starts over. after 60 days in the hospital, you're paying $400 a day. After 90, $800 a day. And after 150, you're paying all costs for a hospital. Hospital costs per day are about $1,500, just if anybody wants to know, depending on where you're at in the hospital. Skilled nursing facility, rehabilitation center, you pay nothing for the first 20 days and you pay $200 a day after that. And any additional days beyond that, it's all costs covered. Nursing home stays are about $4,000 a month to $8,000 a month. It's not affordable if you just have Medicare. Your Part B, which is your doctor's services, not as bad. There's a $226 deductible before Medicare pays, but Medicare pays, but you pay 20% of whatever that service is. Massachusetts has laws that they do not allow doctors to charge more than what Medicare suggests for prices. There are states which can add another 20% on top of that. Florida, I'm looking at you. So you could go in and not only have to pay your 20%, pay another 20% on top of that, and Medicare will cover the rest of only what the Medicare amount is suggested. There's real strange things with Medicare, like you have to cover the first 3 pints of blood if you get a blood transfusion, and then Medicare will cover the rest. You know, it's weird stuff like that. So because, you know, a lot of people don't have other insurance, there's Medicare supplement plans or Medigap. This is for people mainly who only have Medicare. In Massachusetts, and again, these supplement plans are run by outside agencies under the guidance of Medicare. Massachusetts has 3 supplements. There's Core, there's 1A and 1. Supplement 1 is only available to those who are eligible for Medicare after January 2020. Again, these plans are there to help offset the gaps in deductibles with A and B. These plans all have monthly premiums in addition to the 168, 164 you'll be paying for B. You also need a Part D plan to cover medication while you're on there. And these plans are administered by 8 different health insurance providers. You can see here, this is your vanilla straight Medicare with a core plan. You still have that $1,600 deductible, but the hospital coverage is there. After you spend a lot of time in the hospital, you're still paying the after 20 days, $200 a day at a nursing home, and your deductible is still there for the doctor, but Medicare takes care of the full cost. You don't pay the 20%. Supplement 1A, that $1,600 disappears. You still got the 26, but Medicare is paying everything else, and Medicare is also paying longer for hospital stays. This supplement 1 is no longer available for people after 2021, but that gets rid of everything. These are the costs you're going to pay for these. So again, most people I see are Blue Cross Blue Shield 1A, so they're paying $192.63 per month plus $164.90 for the B. So they're already paying $300 and something a month for their Medicare. But all the deductibles are pretty much disappeared except for that $226 doctor deductible. So again, if you have A, B, and Medigap, you don't have coverage for drugs and medication, so you have to get a Part D plan, which is prescription drugs. You can get a Part D plan as long as you're not on Medicare Advantage, unless the Medicare Advantage plan doesn't have drug coverage. Part D plans and their costs and deductibles are based on a number of factors. The level of plan you buy, whether or not you have extra help, the plan's formulary, the tier of medication you fall in, and where you get your medication. There are actually 25 different Part D plans. I have a little list of them here. They range from zero cost plans to $200, $300 a month. the more you pay on a premium, the less out-of-pocket expenses you're gonna have. So a zero-cost plan would have a 505 deductible for medication, and the medication might be slightly more expensive, where a $300 a month plan would have no deductible, would have very minimal medication payments. Medicare D plans have a donut hole to them, and I'm sure you've heard the terms for the donut hole. So your typical D plan, you have a 505 deductible. Then they start paying your medication. During your coverage period, they can only charge you as much as 25%. That's usually much, much lower. That's usually the $2 and $3 and $10 you're paying. Once you hit $4,660, you hit what's called the donut hole. Then you're paying 25% of all your medications. This is what hits seniors with a lot of medications. So now where you've gone from paying maybe $5 for something, you're paying $200 for a very expensive medication. And then once you hit an out-of-pocket threshold of $7,400, you hit catastrophic. You go back to paying 5% for your medications, and Medicare pays the rest. As I said, it's a really ridiculous, complicated, overly complicated insurance. Any questions so far? We will continue on. So the Medicare Advantage plans, and if you're used to dealing with the ACA plans through Mass Health, the Medicare Advantage plans are very similar. There are 50 of them in Bristol County alone. They all have differing costs, benefits, coverage, and coverage. Some have dental plans, some don't. Some have gym coverage, some don't. Most of them have drug coverage. There's only a couple that don't. The general Advantage plans, they're generally cheaper out-of-pocket costs than Medigap Part D. So you might have a premium for your Medicare C that incorporates the $164.90. So you're only paying one premium per month as opposed to 3 or 4. The issue with the Medicare Advantage plans is they're limited in coverage, and they have limited access to healthcare because they're HMOs and PPOs. They are a lot better than when they were first introduced. They are very similar to the plan I get through the town of Dartmouth, which is an HMO. And again, some of them roll the $164.90 into their premium costs. Some of them don't. There are a lot of zero costs Advantage plans. So you may only be paying for the $164.90 and have a zero cost Advantage plan. The biggest part of what a Shine counselor actually does is sitting down with a client and comparing D and C plans with them and figuring out what their medication is, who's going to be their most cost-effective plan they can get into. And depending on the number of medications a person has, that could be a 2-hour meeting. So how to apply for Medicare? If you're 65, you can go to ssa.gov. You can make a Social Security account, and you can apply through the Medicare link on their site without logging into Social Security. This is what I use when someone needs help. It's kind of like applying for Social Security for them. Very quick application. It's about a 5-minute application. You can call the National Social Security line. Again, you might be on hold for an hour. I don't suggest you go to your local Social Security office, but you can. And you can also call your local Social Security office. That's about the same time on hold as the national line. For Medigap, you cannot apply online for Medigap. I don't know why. You actually have to call the companies to apply for them. And again, that's one of the things the Shine counselor can help you do. Medicare Part D and C. I'm gonna show you. That's the Medicare.gov website. And you can actually go in there now and actually put in all your medications and see, and where you live, and see what your plan is by Find Health and Drug Plans. And this again is what a Shine Counselor does a lot of. I can actually enroll somebody from the Medicare.gov site to get a Medicare plan. And again, you're comparing 50 plans with one another, depending on where people live. Oh, I did pull this up. This is actually the Medicare Advantage plan, so you can see how many there are. There are close to 50. And as you can see, they all have different premiums. They all have different out-of-pocket maximums. They all have different drug deductibles. And then their drugs all costs are different depending on what plan they're in. So this is the big thing, is public benefits. So public benefits like Mass Health, the Mass Buy-in at 65. There are a number of ways to qualify for public benefits to assist with the costs of Medicare and cover long-term medical issues. The most common are actually the Mass Health Buy-in programs. Most of these programs have income eligibility. All earned and unearned income is counted. Most of these programs also have asset eligibility, and this is what throws a lot of people who are on Mass Health. Assets are things like that can be liquidated easily for cash, like stocks, bonds, investments, and bank accounts. And your assets, your primary residence is not counted as an asset. Property beyond that is. One automobile is not counted. Life insurance, burial plans, they can be counted as an asset depending on how they're set up. Things like annuities and IRAs can be counted toward income or assets depending on if they're giving you income or not. So for Mass Health Standard, here is the scary part for somebody who's over 65. They've been on Mass Health all their life. They get a letter they need to reapply. For an individual, they have to make less than $1,215 a month. $1,215 a month is the federal poverty level. For a couple, it's $1,644. They also have to have less than $2,000 in assets. So again, if people on Mass Health Standard who are below 65 can save money, this is a lot of times what affects even people who are very low income. They've saved $3,000 or $4,000 or $5,000, and it knocks them off a Mass Health Standard. There is a big push to get rid of the asset standard. We'll see where it goes, but that's currently Mass Health Standard. For someone who wants to apply for Mass Health Standard at 65, they need to fill out the SACA application. If you've seen the ACA application, you know how long it is. The SACA application is 10 pages longer. The application cannot be done through the CAC online portal, through the Mass Health online portal, or the Health Connector. They're still working on trying to get that through those portals, but it's been years and they haven't. There is actually a fillable PDF that can be submitted directly to Mass Health. There is a link to that. I could send that link to anybody who wants. But again, it usually takes me 30 to 40 minutes to fill out a SACA application for somebody. There are a lot of verifications that have to be sent for the SACA, just like the Mass Health application, IDs, income, you have to send bank accounts, you have to send asset statements, you have to send deeds, you have to send vehicle type of things. It's there's a lot of verifications to send for an over 65 Mass Health application. Those who qualify for Mass Health Standard also qualify for the Mass Health Senior Buy-in and Extra Help, which I'm going to explain a little bit later. Actually, I'm going to explain that now. So Mass Health offers programs for people 65 and older to help to offset Medicare costs. It is an expansion of the federal Extra Help program, but it has much higher income and asset thresholds than the federal program has. Clients who have this program are not on Mass Health Standard. They are just receiving from Mass Health and the federal government to offset Medicare's out-of-pocket expenses. It's referred to as the Mass Health buy-in. The Mass Health buy-in is actually a very short application. It's only 2 pages. And there are 3 versions of the buy-in, and all of them automatically qualify you for full extra help through the federal government. The Mass Senior buy-in pays for your A and B premiums, deductibles, and co-pays. So Mass Health will pay those. Again, automatic full extra help. The income is quite a bit higher. It's $2,309 for an individual, or $3,123 for a couple. And the assets are much higher. You can have $18,108 in assets, or $27,2660 for a couple. You can actually go into it in higher income, but they only pay the Part B premium. They only pay that $164.90, and they don't cover the deductibles. They don't cover the other out-of-pocket copays. But you can see the incomes for couple or individual, and the 2 other levels to qualify for at least help paying the $164.90. So full extra help. The federal government has full extra and partial extra help. If you qualify for anything through Mass Health, you automatically get full extra help. So in Massachusetts, if you qualify, you always get full extra help. Full extra help allows you to access 0 premium and deductible plans for both Medicare and Part D plans. So if you go to that Medicare.gov and you put in, I have extra help, a bunch of new plans will open up that are 0 cost deductibles and premiums. You also only ever pay co-pays $4.15 for generic and $10.35 for brand name. And after catastrophic, it will go to $0. Most people on full extra help will never hit the donut hole, which is nice. And if you are that $12.15 per month, your copays will actually be $145 and $4.30. So there are other ways to qualify for Mass Health Standard, being 65 and over. Most of them are income asset qualifications. The Mass Health, if you have a PCA, so this happens to a lot of people who have PCAs, and you don't qualify for Mass Health anymore, there's what's called Mass Health PCA. They will give you the PCA program and qualify you for Mass Health Standard. The income's a little bit higher, $1,616 for an individual, $2,186 for a couple, but the assets are the same. If you are somebody over 65 and you have somebody under 18 in your house that you're caring for, you're the legal caretaker for, that child will obviously qualify for Mass Health. You may also qualify for Mass Health. It's $2,186 for a family of 82, or $2,756 for a family of 3, and it goes higher for higher family amounts. There's no asset check for that. So that's an option for somebody who's older, who's caring for somebody under 19. So the frail elder waiver is actually probably one of the more common ways to qualify somebody over 65 for Mass Health. This is for somebody who's determined to be nursing home eligible, as determined by their local ASAP, or Aged Services Access Point. New Bedford, it's Coastline. Fall River, it's Bristol Elder. I'm not sure what's up in Taunton, Attleboro, but if you look up ASAP, they will tell you who your local aging services are. They're the ones that qualify you as being nursing home eligible. Also, if 60 to 64, you have to be on SSI or SSDI. They will not count your spouse's income, and you can transfer assets to a spouse. So the income is $2,742. We're getting much higher in income. The applicant's assets can only be $2,000, but you can transfer almost $150,000 to your spouse legally for them to qualify for the frail elder waiver. You don't have a spouse, you're kind of out of luck for that. There's ways to transfer wealth through trusts, though, which you have to seek an elder law lawyer for that, which is not going to be cheap. Same thing with LTC Medicare for those under and over age 65. This is actually, again, for somebody who's under 65, you must meet a clinical eligibility. Again, you're qualified for your local ASAP. You get one skilled service a day, laundry, meals on wheels, that type of thing. There's no income limit to that, but there is an asset limit. You can transfer $148,000 to a spouse. If you don't have a spouse, you can transfer money. There is a 5-year look back from Mass Health, and there's various legal ways to transfer money, paying medical bills, fixing houses up, that type of thing. Vacations don't count, that type of thing. Again, as somebody you might want to seek a shine counselor or again, legal advice on that. But that's just how it's one way you qualify a lot of people under 65 for Mass Health, because there's no income qualification for that. So another way I qualify people 65 and older is through Common Health. If you're over 150% of federal poverty limit, they will not pay your Part B premium. 150% right now is $1,823. You must have a disability, a documented disability, and be not eligible for Mass Health Standard. You may have a premium if you're over that 150% FPL. As an example, in the past, I had somebody I was working with in their 40s who was paralyzed, and he had Common Health, and he made about almost $5,000 a month on disability. He had Common Health, and he was paying $95 a month to stay on Mass Health. It's an example. So 65 and older for Common Health, there's a 40-hour per month work requirement for it. Again, they make it difficult for people 65 and older to get Mass Health. The work requirement is kind of negligible. There's a form you need to fill out, and somebody has to sign that they're paying you $1 an hour for 40 hours of work a week. It could be doing filing for them. It could be walking their dog. It could be doing very normal organizing their kitchen, very simple stuff like that. Common Health has no asset or income limit, and that's the advantage. The state is actually looking to get rid of the 40-hour-a-week requirement for 65 and older. And when they do, that's probably going to end up being the best way to qualify people for Mass Health, 65 and older. Again, you can't do the Common Health application online. You have to do it through the SACA. There are a couple other benefits that the state has specifically. One is Prescription Advantage, state-sponsored prescription drug program for people 65 and older. Also people with disabilities who are under 65. Prescription Advantage has 3 different levels, but you can be up to $6,075 per month to qualify for Prescription Advantage. And it helps pay, especially during the donut hole, to keep your prescriptions low or even zero, depending on what you're at. And there's no asset check for that. Some of you might already be familiar with the health safety net. There are certain medically necessary services provided to low-income patients at Massachusetts community health centers and acute care hospitals. Again, the Greater New Bedford Health Center deals a lot with the health safety net. Again, they might have to pay a certain percentage depending on what their income is, but if they're acute but they're acute medically necessary types of things, if you don't have the proper insurance and you have a heart attack, you end up at the hospital, the health safety net will sometimes pick that up as an example. PACE is something I don't see a lot. PACE is a program administered by Mass Health and Medicare to provide a wide range of medical, social, recreational wellness services through local PACE organizations. In Bristol County itself, Harbor Health, Elder Services, and Fallon Health are the ones that do the PACE programs. Again, you must meet nursing home eligibility for 55 or older. The income is a lot higher. The assets are the same, but your spouse's income and assets don't count. You'll probably be going to a day program if you're participating in PACE. and they would be doing almost all your health services and social services and recreational services. So that's basically Medicare in a nutshell. Again, I like to say it's not one size fits all. It's something you really need to talk to somebody about. One thing I do like to talk about here too is SNAP for 60 and older and disabled, because the SNAP rules are a little different for people, and a lot of people don't know this. If you're 60 over or disabled, housing costs and out-of-pocket medical costs are counted different for SNAP eligibility. Your housing costs are not capped. So if you're not 60 or disabled, your housing costs are capped at about $640. If you're over 60 or disabled, they count all your housing costs. In addition, your out-of-pocket medical is counted after $35, where if you're not disabled to 60, it's $195. So if you are over income for SNAP and 60 or disabled, you may still qualify for SNAP because of the way DTA counts housing and out-of-pocket medical costs. If you do qualify, you're over the SNAP limit, there's a further asset check, which is $4,250. And SNAP basically looks for stuff that's easy to liquidate into cash, bank accounts, stocks, bonds. They don't count your first home. They don't count your first car. You know, they actually don't count tax deferred retirement and education loan accounts also, which is also a nice thing. Again, there's a woman who lives down the street who's about $2,800 a month, and I was able to qualify her for SNAP because she has a $1,500 a month mortgage, and she's a brain injury, so she's disabled. So they counted that entire $1,500. So in that formula, got her on SNAP. So I can put this in chat also. If you need to ever contact me, these are the emails and phone numbers I can be contacted at. I generally work 8:30 to 3:30. You can also come visit me at the Council on Aging if you really need to. I'm also doing actually a live training on this at this Council on Aging. I don't have the date yet, sometime in October. Anybody's invited to go. And that's basically it in a nutshell. I mean, I don't know if anybody has questions.
Matt, I do want to just let folks know that the recording of this presentation will be available on our website.
Yep.
At nbhspn.com by the end of the week. And
Okay.
You're going to be willing to share your slides with us, Matt?
I can do that, yes.
I can put that up there as well, because I know a lot of folks are saying, wow, there's a lot of information.
There's a lot of information, yeah.
Yeah, we feel like moving to Canada. Maybe
Yeah.
it's easier.
I always say, hey, welcome to 65. Here's the most complicated insurance in the world.
Yeah.
Well, it's definitely one of those things, but
Yeah.
if you can always email and call with questions. I actually had CCBC actually brought a woman from Attleboro down here because she couldn't get any help up at Attleboro, which is kind of sad, but it's one of those things.
Dolores, did you get your question answered? Dolores had a question about military veterans.
Yes, so that's let me see let me pull the chat up. Let me stop sharing this. Let me see. I forgot how to stop sharing. Pause share. No, resume share. Stop share. There we go. Okay. So.
Yeah, I was wondering about, because I know there's some retirees that are
Yep.
hitting 65 that are getting insurance through TRICARE. So
Yep.
I didn't know
Yep.
how that worked for once
So-
you turn 65.
So yeah, you're better. So you need to talk to your veterans agent in your town. That's one of the big things. Generally with TRICARE, you might not even have to deal with Part C and D and Medigap, because your TRICARE is probably paying you $164.90. That TRICARE will cover everything else. Just as, for example, I have a retirement plan here through insurance plan through the town of Dartmouth. I might not have to deal with Medigap and in a Part C and Part D, because that insurance might be adequate insurance to cover what I need.
Thanks, Matt.
Yeah. One of the other questions was, yes, Dennis, you can bring a client to for the in-person training to the COA, or if they want to meet with me individually, that's fine. I do consult free of charge. I am not the only Shine representative in South Coast. If you do a search for Shine representatives, there's actually quite a bit of them. We actually have 2 out of this office. The regional Shine office is actually in Middleborough. And you'll see, like, okay, I'll do a plug for somebody who's across the street from us. So New England Medicare across the street from us. Some of you may already know Sandy Tiburcio, who used to work for Catholic Social Services. She owns that company. She does Medicare consulting. But those types of programs, or like Medicare, the one on Rockdale Avenue, for example, they get paid from the individual C plans and gap plans. They get a stipend for signing people up. They're actually under Medicaid regulations to give the best information they can give. So I will send people to them if I'm crazy busy. So you can, again, you can go on to the regional Shine office and you put in your zip code. They will give you all the regional Shine counselors. You can talk a little bit more about the donut hole and those. So the donut hole, if you qualify for standard Mass Health or the senior buy-in, all that will get covered. You'll probably never hit the donut hole because your medications will be so low. You probably will never hit the donut hole in a Medicare, on a Medicare D plan or a C plan if it's been set up correctly.
So Matt, it's what you pay to hit the
Yes.
donut, not what
Yeah.
the medications
It's
actually.
your out-of-pocket cost.
Yeah, okay.
And again, as a Shine counselor, I'm going to try to, what I do on Medicare.gov, they will give me what your medication is going to cost in the regular coverage, what's going to cost in the donut hole, what's going to cost after. And again, if somebody doesn't have a lot of medication, they're probably not ever going to hit the donut hole. The people I find that hit the donut hole are these people with 30 and 40 medications. Those are the ones that tend to hit the donut hole. And then that's when we try to put prescription advantage in if they're over income, that type of thing.
But they can hit it even with the Mass Health, like assistance.
So Mass Health, yes, because Mass Health, if they're straight Mass Health, they'll probably have very, very low prescription costs. It's usually $1 and $2.
Right.
So it's really hard to hit that. They're on the senior buy-in. Depending on their income, the most they'll be paying is $10 for a prescription. So they might not ever hit it either.
Okay.
So adult foster care money does count as income to SNAP and Mass Health. The only thing they don't count as income is if you have something set up in a trust, or if you have, there's one other form of income they don't count in it. Slips my mind at this point. But SNAP and Mass Health is pretty much going to count all your income. Yes, New England Medicare Advisors across the street is a very good resource. I use them a lot. Because if I spent my day doing Shine applications, I would never get out of this office.
Anyone else have any questions? I was looking at the chat. I don't see anything else.
I'm going to type my email into chat so people have it.
Perfect, thanks.
Oh, wait, I put commas. They're not commas there.
He really doesn't want you to email him. He just was trying to, yeah. Don't take that down. Oh, Al, did you have a question? Oh, okay.
There we go. That's better.
That was a clap.
Oh, good. Okay. Now, like I said, it's very, very complicated. And even I, sometimes when clients come in, I have to contact other Shine counselors to figure out what's going on. So it's one of those things. And like I'm a Mass Health CAC also. And one of the problems is after 65, I can't access anybody through the CAC portal. And yeah, we're gonna get it there eventually. You know, it's kind of ridiculous there too. So it's one of those things.
Well, Matt, I will say on behalf of everyone here, clearly this is, I think, one of the most popular trainings we have had in quite some time. And we can now all see why. It is a world of confusion. No, but this has been great. Thank you so much for being willing to come on and kind of give us this info. I think folks will probably go back to the recording and go back to the slides to try to
Yep,
digest.
I'll send the slides. Do you want me to send them to you, Jen?
Yes, please.
Okay, I'll send you the slides. And like I'm glad I could give you all headaches. Yep.
I will call out, as Dolores said, Matt's a great coworker. He's been fantastic to work with and very helpful.
Yeah.
With us, with the variety of clients coming from all over the place. So, but yeah, no, thank you so much, Matt. We give everybody about a half an hour back in their day, go do some case notes or something like that. And we'll get this stuff up online and get the slides sent out to everyone.
Thank you, everybody.
Thanks so much for joining us.